Hi, I'm Dr. Tim. In this episode, we're going to discuss the 6 common mistakes that clinicians make that lead to disappointment and disheartening approach to medical aesthetics. This all comes from a number of subtle things that when you know are there, makes everything else a lot easier to interpret. Let's talk about the 6 filler mistakes that clinicians make. Many very well-intentioned clinicians can make these mistakes. They can lead to bad aesthetic outcomes, but also to complications that are unnecessary. In this show, I'm going to help you choose your patients better and avoid the common mistakes that many of us make. Plus, hang around till the end where I'll be sharing with you how you can get a free guide, which is a summary of what I learned from my experience being trained with Julie Horn. One of the most common problems I see clinicians face is that they are presented with an Instagram picture, either something they found themselves or the patient brings it with them, and they try to aim for that particular result only to be disappointed. Now, it's really important to understand that the pictures that you see on Instagram are like the tip of an iceberg compared with what reality actually is. They are a selection of collated images. So even the images on that day, they are the best of all the images taken. They are also a selection of a particular kind of patient. You tend to choose younger, prettier women with fuller lips in order to present your best work on. Finally, there's often swelling in the procedure themselves. So the picture that you get is a massive distortion of what the patient will actually look like in a couple of weeks' time, or more importantly, what the average patient, even with the best clinician, looks like in a few weeks' time. Because all of us are selecting our best case scenario, the best picture from the best patient on our best day, with the best lighting, with a little bit of swelling to help, often with makeup. And all of this creates a big distortion in our mind's eye about what we think needles are capable of. Needle and filler is not capable of all the things that you see in the end result, because that end result is made of lots of other factors. So as long as you know this, you should interpret the images you see as a potential goal, but not measure yourself by them. And that's really the key. Be inspired by all means. Go for the best result you can, but don't measure yourself by those results, because there's a lot more going on than simply a needle passing into a lip and getting that result. Powerful components of getting a beautiful before and after picture is to start with a beautiful canvas, essentially, and this is what I believe is happening mostly around Instagram, is that you have the most beautiful people representing the potential result. It's far easier to turn someone who's quite attractive into someone who's very attractive by doing their lips than it is to start, for example, with a much older patient, say in their 70s. You're just simply never going to get a wow picture. No matter how technically brilliant your procedure, it will not get the same emotional response from the scrollers on Instagram. So patient selection is absolutely key, and this applies not just to different age groups, but different types of lips. You will see any injector who is doing a show and presenting a case carefully choose the case that they work on. They choose the ones that they are most familiar with. Let's call it the center component of the bell curve. Why would you put yourself in a position of uncertainty if you're going to do a show or a presentation? It is only human nature to choose a goal that you know you can achieve. The next mistake that I see is an injection mistake, and this is around not anticipating the knock-on effect of the combination of both filler and swelling in a patient who has the start of a little upper lip crease. Now, you will see this on patients when you look for it, but until it happens to you once, you may miss it. And I see clinicians sometimes even post before and after pictures where you can see the patient has developed a crease on either side of the lips. Now, if you look just at the lips, they may look beautiful, but increasing the volume of your lips on their own leads to an increase in the relative weakness of the structure nearby, which is just as the white lip here loses its attachment to the orbicularis, you have a fat pad, your nasolabial fat pad, which is shifting on top of that, and you can often get the start of a new fold or even a crease. Now, what the patient will perceive if they notice it is the development within 2 to 4 weeks of a procedure of a new line. This is actually avoidable. First, if you don't put so much in that you don't create this relative imbalance of supported tissue and unsupported tissue, so less volume can do it, but you can also prevent it by just strengthening the area of weakness with a little bit of product when you do that first procedure. It's a 0.05 mil linear thread into the crease that's usually just where the orbicularis oris has lost its attachment to the skin. The next injection mistake that I see very often, and it happens more often with newer injectors, I can certainly remember being one of them, is that you go a little bit too deep. Now, when I say a little bit, 2 or 3 millimeters looks like a little bit to a new injector or an inexperienced injector, but it doesn't look that way once you are experienced. So when people replicate what they think is a particular technique from someone they've seen on a stage, for example, but they do it 2 or 3 millimeters deeper, you actually get a wildly different result. For one thing, you get less traction in the lip if you're further away from the connective tissue. But most importantly, a lot of these arteries, and certainly the smaller vessels that branch from those arteries, are exactly at this level. So the amount of bruising can be dramatically different for 1 or 2 millimeters more in terms of depth. So depth is one of the easiest ways to avoid side effects and risk. And even vascular occlusion is less likely if you're more superficial. But more often, it's just bruising, swelling, inflammation that looks dramatically more in a patient where the needle in depth has been 2 or 3 millimeters deeper. The next injection mistake I see is vertical injections on thin lips. It's quite common for people to pick a particular technique and then run with it, particularly when you start. We've got so much to think about that it's an enticing idea to think, if I can just get the one technique that works, I'll just use that for now. Now, there is no technique that works on all lips. And probably one of the biggest errors I see is a vertical lip injection being attempted on thin lips. There simply isn't the room for it. You end up doing far more injections to get a different result, and you cannot create the traction that a vertical injection is actually designed to do. Look closely at the injectors who use vertical injections and get the best result. They typically start with lips that are of moderate, if not even slightly larger size, because this is the shape that best lends itself to a vertical injection. Don't be doing it on everyone. Overinjecting, very common, and it's not always because either the clinician or the patient is asking for something that's not sensible. It's often because of a lack of ability to guide a patient or to have the difficult conversations about what's possible. Classically, the patient who had a great result, who might come back 6 to 9 months later and request a retreatment, hoping for that similar feeling, the clinician may try to, for example, improve the definition of the lip, not realizing that there's still plenty of old filler still there, which makes it harder and harder. The patient then comes back requesting improved definition and more product is added. And essentially, this is like coloring over the same area again and again on a drawing. You actually cannot improve the definition by adding more. But it seems to be quite a common idea that maybe if I just add a little bit more to where the definition should be, I will get more of that definition back, but instead you just add to a problem of migration or lost definition. And so it's done with the best of intentions, and it's done because clinicians don't want to say the awkward thing, which is you can't add more, you're going to actually have to have some reversed if you want to have definition back. So now let's go to what I think you're probably going to find the best part of this video. I want to have a look at some of the aesthetic results that we desperately don't want to achieve. And this is a consciousness raiser. Once you see this, you will never unsee it. So here's one that the first time I saw it took me a while to figure out, why does this patient not look quite right? And it often happens on a very beautiful girl. She's got full lips, but when they're animating, there's something missing. And you know what it is? It's their top teeth. Because if you cover the top teeth with the lip because you've overfilled it, it gives you the sensation that they have no teeth, which is not a good look. Of course, most of us want to have some of our incisors showing, and when the lip is overfilled and you cover this, it creates the sense of missing teeth. So be careful. If you have someone who has a relatively low top lip and you overfill them, you're going to create the same problem. It's better to stop it before you reach that point. The next common mistake that I see is overfilling the lower lip laterally. Now, you should have a lower lip angle, and this angle, if you look carefully on most people, follows the line of the philtrum and connects with the angle on the chin. If you fill lateral to that, which is often not done intentionally, it's just part of the injection, but you add volume to the lower lateral lip, you end up with a sensation of unhappiness. It looks a bit like this. Only a little bit, but if you look at the image here, you'll see what I mean. It creates a kind of sullen appearance, and the lip simply looks like it's maybe rotating outwards slightly. It's just another sign of overfilling. I think the central lip in some people is less willing to rotate outwards sometimes than where the angle is. So if you fill the middle section and a little bit laterally, unless you're very, very careful, it's very easy for a 2 or 3 millimeter break out to the side to create this negative expression. The next mistake would be often termed by patients sausage lips, but let's think about what is causing sausage lips. So a sausage, if you think about it, is a continuous shape all the way along. It's a cylinder, 2 cylinders next to each other. And what they're really saying is that they've lost complete shape of the lip. So instead of having a lip that tapers off gently from the middle and tapers towards the side, and similarly on top the central part of the lip is dominant and it tapers off slowly. Instead, you have a continuous seam of filler, which creates a squareness or a sausage-like shape. And this is relatively easy to avoid if you think about where most of the filler should be, which is more central. The central sort of 2/3 of the lips is probably where most of our injections should go. And the harder you try laterally, the more likely you will create either the sausage look or that slightly miserable look that we talked about on the previous slide. The next mistake, probably the beakiest look of all, is the combination of dramatic overinflation of the medial part of the lip that then causes a crease. There's nothing more duck-like than having two grooves running either side with overprojection in the middle. And this is just someone who's just trying too hard to add volume at the expense of all else. So it no longer fits in with the profile of the face, and it's actually not supported by the tissue itself, which is giving way due to this enlargement in the middle part of the lip that causes a bend in the tissue. So in this particular case, you can see a celebrity who's made it into the paper for this exact reason, which is it looks so obviously fake and unnatural that our brains instantly pick it up. And I don't think anyone intended this. I think it's a side effect of overtreatment. As promised, I'm now going to share my favorite products to use in the lips. Now, before I tell you this, it's important to know that I am completely independent. I'm not a KOL. I don't get any money from any drug companies. These are just my opinions based on experience. The other thing that's worth knowing is I have not tried every single lip filler out there. In fact, I think it takes 1 to 2 years to really know a product because you need to get patients back and see how they respond over a long period of time. And so I really only know about 3 products really well. I can tell you that there's a difference, for example, between the standard Juvenim range and the more expensive one in terms of how that product integrates and holds its position in the lip. I've done this many times with patients who I've seen with the older product and switched them to the new one and then seen the difference in how that product behaves over time. And this is really the core reason why I choose as my primary lip filler Juvenim Bow Lift. So this product is good at maintaining definition, does not attract water to the same degree as other products that I've tried, and it lasts a pretty long time. So it's a 12-month product on average for many patients. There's wide variation between that, but I really like the fact that it's very low extrusion force, integrates quickly, holds its shape well. And I've been using it for years and had very few problems with it that are not similar to other products. So that's my number one choice for doing lip treatment. It's someone who wants a little bit of volume and definition. On the other side, if you are just treating fine lines, a lower viscosity product like Juvenim Volbella is probably my go-to. I have found with Juvenim Ultra 2 that it seems to attract much more moisture over time. And this, in some of my earlier patients, they would come back 1 or 2 years later with more volume than how I'd left them, having never been treated since. And this is, I think, down to how that product breaks down and attracts moisture in a small number of patients. The average patient, it just wears off, but there's about a third of them off the top of my head that feels like it doesn't break down, it just accumulates over time. And I've had less of that problem with the Vicross range, although I have still experienced it, for example, with Voluma in nose jobs, that a small number of patients, it'll expand over time. As I always say, there's no such thing as a perfect product, but there are clinicians who can use products almost perfectly. The point here is you need to know the parameters of your product, which you get over time, and to use them according to what you observe that product's behavior is, rather than think that there's one product that will solve all your problems. There simply aren't. They've all got problems, they've all got benefits, and they've all got things that you can use to sell or discount them. And you'll see people doing this online. This one's bad for this reason, this one's good for this reason. They're all a mixed bag. You need the experience to use it appropriately. If you'd like to see what I learned from my experience with Julie Horn teaching me some of her techniques, then make sure you get the free download down in the description. If you'd like to learn even more about lips from me, make sure you check out these 2 videos. First one is some top tips from Julie Horn on injection technique, and the second one is a free lip tutorial.